Welcome to the Queen Divas, Queens of Fitness podcast. Join your hosts, three-time WBFF world champions and WBFF royalty, Alicia Gowans and Stephanie Ayala McHugh, as we explore all things female health, training, competing, mindset, and living the fitness life every day.
So super excited to be back with my girl, Stephanie Ayala McHugh, for another episode of Queen Divas Fitness podcast, because it's been a couple of weeks. It's been a hot minute. And I miss seeing your face, by the way.
I miss seeing you. You look honestly like you're glowing right now, Ali. I don't know what kind of phase or what.
I'm fat.
No, yeah, shut up. Come on. This is what we do with people. We look at ourselves so differently. So just right off the gate, when we see ourselves, we don't actually see what others see. Just FYI, starting this whole combo, she looks amazing. She looks
I'm
healthy.
joking.
She looks beautiful.
I'm joking about that too, because I've just been talking about it. And you know what? I'm surprisingly okay with the changes that have happened and had to happen inside of this process. You know, I think if I had have tried to do this maybe 3-4 years ago, I don't think I would have been sitting quite as comfortable with how things are right now as I am at this point. I think just moving to a certain stage in my life and how I view things has made me feel okay with it. I mean, I joke about it, but I don't ever like look at myself and be like, oh, you fat mole, like, my God, what the fuck? I don't do any of that, but I do have moments where I look at myself and I'm like, wow, my cheeks are so round right now.
And for anybody that knows Ali and myself too, I'm the same exact
big cheeks anyway.
Big cheeks. Like if we gain any body fat, it goes to our booty, our face, and like our abs. It's like definitely so one of those things, like our cheeks get so full and we look like little kids, honestly.
It is. We do. We look like those little cherubs. Those little cherub babies. We do. Yeah. And it's hilarious. But that's the only thing that I sometimes do. I kind of look at myself and go like that. The other thing that obviously the only other thing where I'm like, oh my God. And even then I don't pull myself apart of it on it. I'm still wearing shorts around, but I'll have a moment of, holy fuck, I have cellulite. I've never had cellulite. This is an estrogen thing. This is all these drugs. And it's horrible because, but it also, I can also look at it. And because I'm this annoying optimist, I kind of go, okay, I really don't love the hair damage, but at least now I can relate. Like now when someone comes to me and they're like, oh, Ali, I've got all this cellulite. And I'm like, you're being a tard. You do not. Yeah. And then in some women, when they actually do, I can be like, yeah, I feel you. I've got fuck in here. I've got that shit too. I haven't had it up until now. So I'm like,
so many women have it and they're so insecure about it. And this is actually something really good.
Common.
It's so common. Cellulite, the hair damage she's talking about, that is so common. Okay. Yeah. Like it happens in the off season for some competitors and then they lose it.
So exactly.
It's so a hormonal thing.
And it really is. And you know, look, I didn't have it for the first couple of cycles. I just found that increasingly from sort of cycle 3 to cycle 6, which we'll go into actually. Last podcast, we really featured a lot of, you know, what Steph had been doing and her latest stuff at Worlds. And we touched, you know, briefly on where I was at the end. And I was, you know, just in that waiting game yet again of where we were going to be at, because I'd obviously gone through a 6th IVF drug cycle, like, oh my God, like I needed any more fucking injections, but I had a whole another month of them. And we went through that. Let me preface why we went through that. And I made the decision to do that because we had our failed transfer. So we'd only had 4 embryos that were normal and healthy and ready to go on ice. And we had one of them, and you know, like this is a frustrating thing, Steph. I was like, all right, my uterus is amazing, right? I've had babies, healthy babies, everything's fine. We just need to find this goddamn embryo that is the one, and then it'll go in and it'll take, and I'll be fine, I'll be pregnant. Well, fuck me. Like everything else with IVF, you cannot ever have an expectation because it never goes that way. And now it turns out I ended up, since I spoke to you last, having to have myself, man, the things that have happened to my body in the last 12 months, far out, Jesus. I had to have myself cut open last Monday with a laparoscopy to go inside and look at my organs and my uterus to find out what the fudge. Because all of a sudden, you know, this very healthy embryo in a very healthy body in what looked like a very healthy uterine wall when they were doing my scans. I was in a great place. I'm doing textbook, everything fucking right. I'm annoying myself with how good I'm being. And it didn't take, right? Well, it may have taken, but then we've shed it, we've lost it, right? So, so we've had to kind of go, all right, we've gone back and looked at the depressing stats that really, the IVF stats are so depressing. And we went, right, on average, it can take 3 to 4 transfers for you to take. And I'm sitting there going, well, shit, baby, we've only got 3 left on ice. So what are we going to do if we get like 4 months down the track and we've gone month in, month out, none of them have taken and I've got none left. And then I'm 5 months older and the embryos are that much older again. And then you're trying to find the good ones and it's the needle in the haystack all over again. So I made the decision that after that loss, we went straight back into another cycle to try to get at least the one we lost back, but hopefully more than one if we could, right?
Oh, okay. I see. So
and what we also did was go, we need to investigate. So we need to also, okay, yep, fine. We're going to go in and try and recover your losses, but we also need to cut you open, Ali.
To know what's going on.
And know what's going on. So people listening
how did it
to
go?
this.
So,
well, okay. I had this surgery on Monday last week. I honestly.
So where did they cut open? Where did they cut you open?
Okay. I'm not even going to show you because it's so gross. It's like this really, have you ever seen a baby's umbilical cord and they cut the cord off and it sits outside the belly button and then it goes like black and falls off? That's kind of what my belly button
I know exactly what you're talking about. But is it right? Oh, so they went through the belly button.
They sliced me open in my belly button. And then they sliced me open where your hip bone is. They come up just either side of the hip bone, slice me open there. Then the pubic bone, they come up about that far and they slice you open there. So you got 4 big incisions. You got 4 people inside the operating room with you. It was a 2.5 hour surgery. They then go in, they balloon your belly up with gas so that there's room around all of your organs and bits and pieces and they can see it, right? And then they basically microscope down in it and obviously the people helping my physician, my specialist are there to help, push organs in and away and around so you can see things. And what they were looking for was a couple of different things. So they were, when we didn't have the success, which everyone thought we would probably most likely be successful first transfer, just because I've been doing everything right. I'm super healthy. The scanning showed my uterus wall to be looking great. Like there was there was no reason, right? So then they were like, okay, well, hell, we need to go in and have a look at what may be going on. So we planned for this straight away because we don't have much time to waste, right? So it's like just boom, boom, boom. I had that surgery. It was only like 2 weeks later, and then they're cutting me open again in all the 4 places. And when I woke up, they said to me that, right, we found this one little patch that we think is very old level of endometriosis, very minor. Because let me just say this, I've never had any problems, never had any issues, never had any symptoms, never had really bad periods, never had nothing, right? So this is something that I want everyone and that's listening to this to listen to, though, because you can be like me and have absolutely no signs of anything and then be cut open and find that you actually have stuff going on. Right. And it might,
no, you're right, Ali.
It might be in other ways.
Exactly. Like you just have a heavy cycle and you just think like, you're just dealing with some normal symptoms that may linger a little longer, but you really don't know you're dealing with endometriosis. And I think it's really something I'm very interested because I know I have lots of clients that have endometriosis.
And there's different stages. So, you might have because mine is in a high stage. So I'm not someone that is like a stage 4 where, it's still an issue though. Exactly.
It's causing fertility problems.
Yeah.
So this is what's leading. So this is the root of the issue.
So this isn't actually, this is where it gets super fucking interesting just because there is nothing easy about me ever. Right. And let's face it, I like to be like, I do everything at the highest level. So even when it comes to this is how it managed to roll. I had this tiny little patch and they showed me it afterwards. And they showed me the picture and they, cut that all out and whatever else. And obviously, and it's old, it's not been an issue. It's not grown into any organs or anything, but far out. They then go, oh, and they said, and here's your ovary. And they showed me the pictures of my ovaries and they were quite sort of enlarged. And they went, but this is probably common for the fact that we're only 10 days post an egg retrieval where you were really swollen. And I had 30 eggs come out, 30 follicles, 30 embryos. So it was like a lot, which means I had overstimulation. So the ovaries were still quite swollen. But then they showed me my uterus. Now, do I know what's really annoying, but also kind of makes so much sense? As we've talked about, I've done a whole year, but I have done 6 back to back with only exception of 1 month where I did the transfer of a break, right? Pumping massive amounts of estrogen into my body. Like I'm talking, I think we've mentioned this before, your normal levels are like 80 to about, I believe it max like 800, right? My levels were sitting at 22,000 every month. I was only getting them down a little bit. And then I was going into my next jabbing cycle and blowing myself up again, right? So this is where the cellulite happened. This is where all the excessive estrogen is. This is where I've put on, additional body fat that every time I go through a cycle, I'll lose a little bit, but I never lose everything I've gained. And in this last cycle in particular, I'm really struggling to drop what I put on in the cycle itself. Now that might also be because we've had this surgery and I'm healing and everything else too, who knows? But it just goes to show you the level of excessive amounts of estrogen. Now I'm driving that home for a reason, because there is endo, and we're gonna double back to this, and I want to talk about these situations a little further, because these are the things that a lot of women face and have problems with, and we see it frequently. But there is actually another condition which is not talked about, which is not really I don't think many people would really know about it. I definitely didn't know anything about it. But the annoying thing is, even though I might have had a slight predisposition to this, and also I've had pregnancies. So something that can lead to this is multiple pregnancies, right? So I've had pregnancies, I've been pregnant, had babies. This can lead to us to, but when we first started this process, I had an MRI and I had the testing done on my uterus and there was no issues. All of the hormones have led to this heightened state now, and I've been diagnosed with adenomyosis. So I have both endometriosis and adenomyosis. Now, adenomyosis is actually an inflammatory disorder that is, and this is the scary part. I had never gone through this before. I had never actually even had a client say they've had this before, but 1 in 5 women have it. Really? Now, the difference with this is, it's like endo's darkest, ugliest sister. It's way worse than endo because this can't be treated. So we can't take it out. We can't do anything with it. So what is it?
Yeah, what is it?
Okay. All right. So my uterus was a little swollen and a little what they call boggy, which is basically where if you were to touch a uterus that didn't have this, it would be pliable and soft and like move. Like, like a waterbed, move quite a lot. Exactly. Mine is more like a half waterbed, half mattress. So it'll move, but like not all the way that it should.
Doesn't have as much fluidity.
So exactly. And what that is caused from is actually an endometrial tissue that starts to grow into my uterus muscle wall inside my uterus. So it thickens it up. And, look, there can be a predisposition to this genetically. So you can be born with a predisposition to this happening, right? So
fetal that was actually going to be my next question. I was going to ask you, was something developed or was it something?
So I never had any issues, and I've had, obviously, I've been in situations where if I was going to probably have it sort of caught, it probably would have been because of pregnancies and stuff, but I've never had any issues, not whatsoever. The hormones though that we've been obviously pumping into me have added to this, and it's most likely exacerbated it, right?
Yeah.
Exactly. Another thing that can cause this too, for anyone listening to this, is if you have had injury at all. So any kind of injury, any kind of
trauma,
wound,
like a
any
big
kind
trauma,
of, any kind of trauma, even possibly having had or gone through like laparoscopies and stuff like that could potentially lead to this. Exactly. The
It's like
other
scar
thing,
tissue, you're thickening up the wall and just starting to really become not fluid. I mean, you have to think blood flow, and that's actually how, I mean, guys, you guys aren't thinking here of just our biomechanics and just how our size like, and our body is physiologically. It's very important to know, like blood is what fuels us along with oxygen and water. And when we aren't stabilized with our blood regulation for women specifically, we have a cycle for a reason. It's not supposed to be taken away. And for those that are maybe even doing things to get their cycle to go away is going to be dealing with more of these issues down the road. You know, obviously lifestyle circumstances obviously cause this, like you said, hereditary, and you're born with it and it's genetic.
It can also be from having like a cesarean. So if you've had a C-section, ladies that have given birth and had a C-section, that can also be a preliminary precursor to this, right? So you can actually have a situation where the uterus may heal towards the muscle rather than outwards. And then that can create a thickening of the uterus lining. Now, the reason that I'm bringing this up is because it is not as talked about, as known. It's definitely not a word that most people listening to this may have even heard before, right? But it's actually very common. And that's why I wanted to talk about it, because if I had have been able to be taking anti-inflammatories and other medications, I could have potentially been treating it or slowing it down, right? But because we've been doing the IVF, I couldn't take anything. I've been off all meds. So I've been like literally fueling the fire and not putting the fire
exactly
out.
What you're actually
but
doing.
You don't, but you don't know that you've got it because it's an internal thing. It's very hard to see. Direct ultrasounds don't show it up. You know, you can get an MRI, which I think
so only MRIs, like MRIs will
and it can show a little bit, but it's not conclusive. So like we did the MRI, I think I remember we talked about this. I did the MRI straight after I think we had the loss when you were on stage, and 2 or 3 days later I was in having the MRI and all my blood work done, and the MRI came back with like, it showed only like a slight little something, but it was like really nothing. And that's where my specialist was like, right, we're booking you in 10 days, you'll be going underneath the knife, because we really need to go inside and see, like we can't see anything, right?
It was like that dot rises, you know, and sound like it just really makes you want to dig in further. And MRIs are a great way, but is there another way that they would have said that they would have been able to find?
It would literally only be the exploratory based surgery where they can blow you up and actually see. And then the other thing they did while they were in there, right, because for everyone listening, this is also something, if you're trying to conceive, you need to think about. I have an autoimmune disease, right? I've had it for a long time now. I got diagnosed when I was 25. So ulcerative colitis, there's a big family history of Crohn's and bowel disease, right? So autoimmune is a problem sometimes for women when they're trying to conceive, because what will happen is the body will produce an excessive number of these natural killer cells, NK cells. Now you need them, and they are actually normally inside of your reproductive area. There's a certain amount, and we need them because they actually help with the implantation. So I'm bringing this up because this with the adenomyosis is a problem. So this explains why my implantation did not take, right? So I actually, when they were in there, looked at it all and went, yep, you've actually got a way higher number of these NK cells than what you should have. So they take a scrape and a scratch of your uterus lining and do a test. And then with that, once we've identified that there's too many of those, as well as this hard, like little bit of like a thickening / hardening in my uterus, it's like, right, well, now we need to combat these things. So my body's producing too much stuff, and then it's being pumped with this other stuff, and there's all these things all at once just combining for this big, you know, double whammy. So I might have looked, and this is where it's really difficult for anyone's trying to conceive and they're having, you know, no luck. Maybe just don't beat yourself up and don't go, oh, there's something I'm doing wrong, or there's something, you know, I think you just need to go and investigate, right? Because 100%, clearly you can be healthy, do all the right things, follow the textbook, be prepared. Like you can literally have no life of fun because you are literally eating nothing but vegetables and still not bloody fall, because there might be something going on inside you can't see.
And what you just said actually really hits on so many surfaces. I think it relates so much into fitness as well. If you're doing everything, meaning like you feel like you're hitting all your nutritional, diet, you're hitting your workout plan, you're doing everything to the sleep, you're getting enough sleep, you're drinking your water, your hormones are in check, your cycle's good, and there's still like nothing happening and you're not seeing results. There's something in your blood work that's gonna arise, that's gonna tell you, that's investigating and being able to figure out what deficiencies, organ dysfunctions that you may have. So these are all things, just like she said, finding the root of the problem and getting under and doing some investigation. And you're not the problem all the time.
No, exactly. And also recognizing too that there are things that can be treated, right? So we'll go back through to this. I'm going to give a little bit of an overview as to endometriosis, adenomyosis, and then we're going to also talk on polycystic ovary syndrome, because they're all part of these group of pelvic inflammatory disorders, right? And they're things that can be either treated or managed. And, like in my case of the adenomyosis, I can't actually do anything physically for that, but you can manage it by actually, having anti-inflammatory medication. There are things they can play with your hormones to try to reduce the excessive estrogen so that then the uterus has time to actually, because it's like an inflammation inside of your uterus, to manage that. So let's touch on this for a minute. For everyone listening to this, what exactly is it? So adenomyosis is an inflammatory disorder that basically, like I said before, found in 1 in 5 women. So a lot more than what you would
20%, you guys.
Exactly.
That's a big percentage.
And the scary part about it, like I said, is that it's the main treatment that they do is they do a hysterectomy. They rip your uterus out. No! So when you get bad enough, that's what it gets to. I'm trying to have a baby here. I kind of need my uterus, so we can't go down that route for a long while. But just for everyone listening, these are the things that might be signs of adenomyosis. Are you having really heavy bleeding? So menorrhagia, really, really heavy bleeding.
Menorrhagia's there, yeah.
Yep. So dysmenorrhea, so really painful periods. So you might have no other symptoms on this, just really painful.
The sharp pain. Yep. Migraine.
Really heavy
throwing
cycle.
Up. Yep.
So a cycle normally you should have like your heaviest day, like day 1 or day 2. Absolutely. Usually it's around day 2. You'll have like 1 day, maybe 2, and
like
that's normal.
24 hours to 36.
And then it tapers off, right? And if you're having a situation or a period where it's way heavier, way longer, big long periods where you've got pain in the pelvic area, you've got intense cramping,
like constantly, because we obviously have some normality when it comes down to some cramps. So please don't think you can self-diagnose yourself and think that you're having one of these things. Another thing is breakthrough bleeding. If you're having like a cycle and then having another cycle, but maybe mid-cycle you've just got this random level of spotting of bleeding, like a little spotting, like the spotting at 2 weeks after. Normally when you're supposed to not be in, obviously you're supposed to be in the luteal phase, you're actually really trying to, obviously get in a good state, and you start seeing the spotting. It's happened to a lot of people I know, a lot of clients I've coached, when they start getting spotting or they have really heavy bleeding and the symptoms and really, really bad cramps, headaches, and can't train, they can't do much. And it almost really cripples them to where they're bedridden. And the bedriddenness obviously causes a lot of other problems, meaning like you're depressed and your hormones are, out of whack. You're starting to feel like you just need to go through the pantry and just like make yourself feel better. And it's not that. Like it really is, like Ali said, is red flags, and being able to look at yourself and know, is my cycle being irregular all the time, not just irregular for this month.
And this is where, I think for everyone listening to this, where these things might not affect you, and you might have no one in your family that has any of the things we're about to discuss and are discussing, and that's fine. But that doesn't mean that you're not going to potentially have this at some point. And it's also, I think, worth, and we've talked about this before, track your cycle, track it all the time. Start to get to know your body, start to understand if something is shorter, longer, broken through, if there are more, fatigue, tiredness, dizziness, like symptoms that you might not necessarily think are abnormal can be really quite abnormal signs.
You forget.
So,
I know I forget what I did yesterday sometimes. And if I don't track it and log it, I'm going to be like, oh, I forgot I felt that way yesterday.
Another really interesting thing too about adenomyosis, which again, as I said, I've never had any symptoms. I've never had that bloated, distended belly. I'm always super lean. I've never had like super ridiculously painful periods. I've never had any of those. I have had in the last year or so, maybe a little bit more pain coming into cycles, and I've had a little bit more through the pelvis rather than just through my lower back. Now that could have been a sign of some early small sort of signs of this happening, right? But nothing crazy. But the hormones from the back-to-back IVF, processes have just gone boom. And I'm just huge all of a sudden. Like the uterus itself has become quite swollen, distended, and sore. So even as I drop weight post cycles, I'm noticing that where I've had that injection site, but that's also therefore where my uterus actually sits, it is sitting a little bit more protruded. So another sign for people is if you have a slight enlargement in the area or you feel pressure potentially on your bladder, you're going to the toilet a lot more, that can also be a sign of this swollen uterus / adenomyosis, right? So for everyone listening to this too, it tends to typically hit women that have had multiple kids. So if you're in your, late 20s, early 30s, but you started your family young, you could be suffering from this. On average is that it usually hits women, like late 30s into their early 40s. Because that's usually when most women have, started to or have had at least a couple of kids, right? So that's common, can be an age thing. The only thing that treats it is menopause, or they take your uterus out. So having said that, this is what we're doing with my transfer. When you ask me, how do we go and where we're going to?
Nice.
We're going to double back, and I will talk again about the endo and the polycystic. But before we get to that, because with the adenomyosis, the only thing you can really do with it is you can have anti-inflammatory medication, which I can't take because we're trying to fall. You can control it with hormones, which is where they put you into a menopausal state for a period of 3 months. They basically switch your ovaries off. So no more estrogen being excessively done. So you go into this menopausal state where you'll have hot flushes and mood swings and all sorts of crazy psychotic stuff going on. I don't want to experience this.
I was like, I feel sorry for you.
I know. So what will happen for me is this. It's not severe enough that they're like, we need to immediately shut you down. It's not like that, but it is a problem, right? So we're going to do 2 things differently in my next transfer. We're going to go for another transfer, and I can announce that we had an amazing outcome. When I was on the podcast with you last, I think we'd only just heard the news, and we only just got told that we had, I think, 1 embryo, but we ended up with 7 fertilized, 4 under biopsy, and 2 that came back normal and ready to use. So we
oh my God, I'm so happy.
And we have an extra one on ice. So I'm pretty happy. Very
that's
happy.
Amazing. That's such amazing news.
I know.
Hey, 7's my lucky number. So that's why it's Stephanie Ayala 7 in my handle, just so y'all know. Actually, 7 is my number.
When you fall pregnant on this one, Ali, it's really the Stephanie good luck rubbing off, right?
I'm just giving you all my best vibes right now. You
I love
said
it. I love it.
took on, and I'm like, that's my lucky number. Okay.
I love it.
Anyway, so what's the next steps after?
So now what we're going to do is we're actually going to do an intralipid infusion. So the days before, okay, I need to wind this back a fraction though. I'm not even done yet. I've got to go back in next Tuesday for another sort of biopsy surgery thing where they want to just check the cells in my cervix as well. So that happens on Tuesday. Then literally within the week, I'll do my first intralipid infusion. So this is actually going to be a process where I have to sit in there for 2 hours and have this thing infused into me. And it is directly going to work on and I guess try to manage that NK cell situation, so the natural killer cell, because if the numbers are too high, it fights the embryo like it's a problem and it won't implant. So they're going to infuse me for 2 hours so many days before the transfer. Then I have the transfer. On the day of the transfer, I get another 2-hour infusion. So they implant me, then infuse me. And then they do an early pregnancy test, and the minute that I'm pregnant, they infuse me again. Because with adenomyosis, the risk with this is if you have this, you have really high risk of non-implantation and a really high risk of miscarriage. So your capacity to actually carry the baby full term is significantly reduced. So it's a real shit show, right? I'm trying to stay super positive about it, but it's like, oh my
no,
God.
I love I'm just thinking of the process, and I'm thinking of everything that you're having to go through, and I'm like,
it's
wow,
intense.
This is a journey. Yeah,
this has actually been a journey of all journeys. This has been even bigger than my broken back situation.
That's what I was gonna say. I was like, I think this is bigger than your recovery and having to come back,
100%.
winning 4 championships technically afterwards,
100%.
you know, a USA title and 3 world championships, you know, literally after. I think this is definitely more of a test. And going to show you that this is a lot more mental than it is physical too, because it's not like she's having to excruciatingly train or do and put her body technically in this big stimulus or like exertion. It's actually backwards. It's actually opposite of what she's used to doing. She is not training and gaining weight. And well, I'm just saying, like, she doesn't get to train as much as the way she likes.
Yeah, I don't. And so I don't get to train because like with the cycle, you can't actually train heavily at certain points. Your ovaries and uterus are so enlarged. There's just, you couldn't anyway. Then you have a surgery and you can't afterwards.
Train with your period, like on your first day. Like shit.
But
like you don't want to.
It's like your period jacked up on a period steroid and trying to be an Arnie at the same time.
And then trying to squat 200 pounds or like
super ridiculously hard.
It's really difficult.
That's the changes we're making to the protocol with this next transfer. You know,
a great game plan. It seems like a great game plan. I think you guys are and like in for it. You figured out, investigated, you got a lot of the data. I think you guys are in for a great road these next few weeks. And it's about staying positive and obviously trying to look at, you know, the bright side of things. And you can have such more, I think, possibilities now going into this next transfer.
And I feel like that too, because they say that after you've done a laparoscopy with the uterus scrape, like they've done for me, that actually increases fertility implantation by 30%. So that's great. Amazing. I'm having a frozen embryo transfer. So that's a 60% higher success rate. So that's great. So my numbers now I feel are better. But also we've got this process that we're doing with the intraliquid infusion, which will, you know, down regulate those NK cells. So that should also help. So I'm saying super bloody positive, but I am, you know, super keen to, you know, make it very, you know, known to women that there can be things going on internally that you are not aware of and can't see. You could be completely asymptomatic for things like endometriosis, adenomyosis. You may not even be aware that you have cysts on your ovaries. And these can be the things that might be stopping you from conceiving naturally, right? So doubling back to, you know, the whole adenomyosis, it is quite common for women with adenomyosis to actually have adeno, which is like the biggest punch on both sides of your face at once. It's like you've just kicked me in the vagina. It's the worst news you could possibly imagine.
Double kicked it.
Double kicked the vagina. So with so let's talk through this, because we see, I would actually, you know, honestly say that I have the majority of women that I deal with that have some form of pelvic inflammatory based disease or condition. Absolutely. I've got a lot of them. Some of them have had surgery to ease, to manage the pain, to manage the process. Others probably should look into it. But for women that are listening to this and they're, you know, just not sure, but you might be experiencing completely irregular periods of bleeding. You might have pain in your pelvic region, lower back, legs that are quite intense. You might have the dysmenorrhea that we've already talked about and having, you know, really
heavy blood flow,
just menorrhagia and really heavy blood flow. Exactly. You might have pain during ovulation is a sign of endometriosis, right? So endometriosis, different to adenomyosis, is still that inflammatory condition, and it is still where you have a cell that is basically growing outside of your area. So it's still doing the things that it's meant to do every month, which is shed and bleed and all of the things that but it's doing it maybe
outside of it.
attached to your lung or to your
Yeah.
bowel or somewhere else.
To the wall.
Which is
Yes.
horrendous, right?
Yes.
So it can be found even up in your lungs. This is what blows my mind. Like endometrial cells can actually travel. So if you are not aware that you've got it, not treating it, and then you go too far too long, you end up stage 4, and they go in to remove it, and it's already connected to, you know, a substantial organ, or it's traveled. Yeah. For some women, they'll say we have to do a hysterectomy and take everything out, but then you might still have problems because it's growing on a lung. There's nothing you can do about that. You know what I mean? Like, it's really it's intense. And it's scary.
It's a deeper problem. It is, because I have some women 100%. That deal with it older versus obviously younger. I think the ones that deal with it younger deal with it a little better, because like, as you said, as you age and it gets worse and the stage gets, obviously worse, they're not able to really almost reverse it, which is something that you can help with reversal if you take those procedures and obviously go by the means of how you are. But with your endometriosis, I'm so interested. Like that.
The adenomyosis sucks, right? Exactly. It sucks. It sucks because it's just
autoimmune disease. Like it's like autoimmune.
Exactly. And unlike the endo, you can't go in and cut it out because it's actually, it basically is like marbled all through your uterus, like muscle. So it's like you can't do anything about that, right? So with both of these situations, the biggest complication is that you have potential infertility, or you have what we call subfertility. So with endo too, just for everyone to be aware of, it actually has an impact on things like anxiety, depression.
Absolutely.
Serious pain with endometriosis. I've had clients that literally will message me, they're stage 4 ones. Some of them have had, some of them have actually had surgery. Some of them have multiple surgeries, and they will literally have some months where they're like, Ali, I'm like, I cannot eat. I'm in my bed. I can't get up. I'm excruciating pain. I'm drinking alcohol to numb it. Like, I've actually had a couple of clients be like that. And it honestly breaks my heart, because
living in pain is not normal, everyone. It's not normal. I think a lot of humans and everyone around the world normalize kind of being in pain, thinking like, especially women, we normalize periods being painful, and I think we normalize having heavy blood flow.
Really shouldn't be.
And it shouldn't be something we normalize. No, correct. It should, look, we should have a flow. Yes, you're going to have a heavier one at the beginning, whether, like we talked about, first 24 hours or even up to 48, if you're one of those that have a little bit of a heavier, but it should lessen and get lighter as the days go on. An irregular cycle would last anywhere from 5 to 7 days. Well, normally, some people that are even regular can be as low as 3 to 4, but that to me is even more irregular than regular being 5, honestly, because those that have a very light flow, I'm like, you're lucky, but at the same time, I wish you would actually bleed a little bit more, because I know the function. You know what I mean? That it does for our bodies. But it is something that you should not normalize if it's extremely heavy, the full 7 days. And let's say you go over 7 days, or you're having these excruciating pains, you're in bed ridden, you are having migraines. And like, I've had clients do throw ups, like they're just in nausea, like they're just literally vomiting. That's
actually a good point. Nausea and fatigue. Like, I'm talking like, you've been punched level, knocked like out, a throw up, like you might have, like you just need to go. A sign. That's not normal. You have that. That's normal. Where you need to go get checked. So you want to know the stat on this, which I found incredibly wow. There's 190 million reproductive women that are affected with endometriosis globally. At this point in time, there's approximately 10 to 15% of the entire population of women on the planet have it. That's
crazy. That is numbers trip me out, y'all. I don't know if numbers don't trip you guys out, but stats get crazy. And if you're not tracking stuff or investigating and trying to do your research, this is such a great way for you to learn, no matter what it is that your interest is, whether it is obviously what we're talking about, endometriosis and endomyosis, or if we're talking about even statistics about food. So many people don't know the myths behind food, which blows my mind. Like, just looking up and doing your research, people, please use your resources. Don't go on
Exactly.
just Google and Google it, because Google has so many misinformation, but make sure you do have some good sites and some good, medical groups that you can, go and get some good information from.
And look, there are definitely therapies and modalities and treatment that does not include surgery for endometriosis. There are ways to manage it. There are definitely, options for you. So there's anti-inflammatories, there's medication, there's definitely hormone therapy that they will use with you.
Talking about anti-inflammatory is my and this is something across the board. It's my favorite and most used for all my clients, myself, is going to be turmeric, guys. This is all natural.
Yes,
literally an
100%.
all natural herb that you can just
100%.
use. Turmeric is the goat. I mean it. It's the best anti-inflammatory, antioxidant, just all
awesome.
natural. Yeah, it's amazing.
Yeah,
so if
it is
anyone's
good.
dealing with inflammation, that is a tool that I would recommend, and supplementation that I would
And
add in.
I find a lot of natural Chinese therapies are great too. And a lot of the Chinese medicine will use compounds and, looking at all natural based herbs and, options that actually treat these things. So, I think look at your options, definitely if you feel like you could be in the basket for potentially having this, go and investigate, see your specialist, get the test done, learn just where you're sitting with it, because then you can start to look at how you treat it, but also doing things that relax you and help with, pain management and central nervous system. I think yoga and relaxing activities that literally will prevent you from getting into, these heightened states, I think is great too. I always have my girls, making sure that they're doing meditation, making sure that they're doing things that, put them into calm states. And then, heat packs are just God's gift.
Yes, they work. They do. They
really
work.
are. I mean, Jesus Christ,
work.
they're amazing. I've been living with them literally attached to me for the last year almost.
Yeah, heat is always going to be a great way. So the heating pads, I really recommend, even for any kind of pain. I think muscular pain, that's a great tool to kind of use whenever you're having. So having a heating pad around, girls, is a great tool to have. Okay, like that, and also have just a little bit of some turmeric. I mean, I would implement turmeric on a daily basis. I take it in pill form. That way, I have joint pain. I get inflamed very easy. I retain water from having different, inconsistencies sometimes in dietary, just things. And I really consistently use turmeric and notice a big difference in joint pain and just inflammation. So that would be something.
Yeah, 100%, 100%. And so, look, a lot of the times when we're looking at, why someone might be slow to conceive, they might have been trying for a while, they may have some of these symptoms or not. These top three things, being your endometriosis, your polycystic ovary syndrome, and adenomyosis, can be some of the biggest reasons why. And you visually can't look at someone and go, oh, yep, she's got PCOS.
She's got, exactly.
She's got adeno. She's got endo. It is not visible, right? I would say though, out of the three things, right, there are probably a few more physical symptomatic signs of polycystic than there are the other two. So polycystic ovarian syndrome, PCOS, as we call it, is, super common, and it's actually caused by an imbalance in your reproductive hormones. So basically, it's where we see women that have quite high level testosterone and they're lacking in other hormones. So they're just not balanced. Now, one of the leading causes of female infertility is PCOS, and it's because we don't have the normal flow and surges, and we're not releasing the follicles, not releasing the eggs. We're just not. It really limits the process, right? So this is where you'll see, someone really probably needing IVF, because it's where they'll get the support with the synthetic addition of, drugs to help with this, right?
Hormones, sure,
but with PCOS, it's the one where you will see things like thinning hair, really oily skin, and acne. Yeah.
Or even just like a very big like, I don't know, it's not dandruff, but it's more of like a very dry scalp and a very dry skin, like their skin gets really dry and flaky. PCOS really hits every woman a little
differently, exactly.
Yeah.
And
so
they have a hard time losing weight. They tend to gain weight really easily. They'll have
they can't lose weight easily either. They gain it very easily, but they can't lose it easily.
Exactly.
They grow hair excessively.
It's their hair. That's the next
like
one. The thin, downy hair on the face.
Start getting a little, mustache and a little, little peach fuzz around the cheeks. All that kind of, and it's not, don't shame yourself for these things. When these are signs that you're hormonally in a state where your body is talking to you. It's letting you know hormones are elevated in different areas that they shouldn't be. Maybe obviously downregulated in areas that they shouldn't be. So just trying to look at these red flags and symptoms, whether if it is endometriosis, endomyosis, like you said, an ovarian cyst,
and with
PCOS.
With PCOS too, though, the best thing about it in one sense is that there seems to be quite a lot more treatment protocols available, in the sense where there are, medications that can support the process. There are changes you can make to your lifestyle, food and diet, choices alone. Activity affects it in a positive way, so there are definitely things that can be done. What's interesting about it is that 80% of women that actually have it have insulin resistance. So you'll see a lot of people when they say, oh, I've got PCOS, so I can't eat carbs, right? Now, I would always say, go and see a dietitian that specifically clinically deals with this particular disease, because not everyone has that insulin resistance. And then you might be removing food groups without needing to. So, I would always say, don't just go, I've got this, therefore I can't eat that. Go get properly tested. Find out where your actual, insulin resistance sensitivity sits, and then that can then be treated with food, right? So, don't just automatically assume you can't eat them, but just know that that is a common side effect of this. And this, again, also affects over 10% of women globally. Crazy.
Our cycle causes a lot of problems, but then we go in and fuck it up even more by trying to unregulate it, trying to get it to not work and trying to get it to take the pill and IUD. And look, these are all personal things, but we have to understand the aftermath and the actual, consequence exactly that's going to happen afterwards if we are trying to, obviously have some children later or not have these symptoms.
And look, even if you don't ever want to have kids, like I would always say to the young girls listening to this, you might not want them now, but I'm a prime example of someone who, didn't get with my Mr. Right. I went through a process with someone that, I just stayed in a little too long, perhaps with. I found my Mr. Right as a result a little later, which meant that when I really wanted kids, and I really wanted to plan for it, I wasn't in my, late teens, early 20s anymore, right? Not at all. So for me personally, these things affecting me now are affecting my fertility, but I can be, 100% honest and say, I wish I knew all these things back in my early 20s, because I probably would have kept a better check on them. I probably also would have planned for things a little better, and I would have made the decision, and I've talked about this on a previous podcast, and for everyone that's reached out to me post that podcast actually and said to me that I've inspired them or I've encouraged them and they've now booked appointments to go get their embryos frozen, I applaud you. I am so thankful that you've listened to it and taken something away, because you shouldn't settle with the wrong guy just to have a baby ever. You shouldn't be forced to have a baby young just because it's when you can. You shouldn't be made to feel wrong for finding Mr. Right late and having babies later either. But what we should all be aware of is that, unfortunately, the longer we leave it, the more risks we're taking. So all you need to do is get your freaking embryos on ice as soon as possible. And if you are someone young and you might not necessarily think you want a child, or you haven't found Mr. Right yet, but you've got signs of, or you've just been diagnosed with any of these conditions, manage them well young, because I guarantee you may change your mind about what you want later. And you don't want to do the reckless things young when you think you've got all the time in the world and you'll live forever and everything is, a possibility. you don't want to be reckless and then not have what you want later because you could have made better choices younger. You know what I mean?
Absolutely.
So I think education is important. I didn't know about adenomyosis at all until I'm experiencing it.
Thank you for educating us. That was that's a great topic, because so many women neglect just the symptoms. And what you just talked about, I think, can relate to a lot of women that have symptoms that they're just unaware are actually red flags, that could be looked and researched and like dig a little deeper and find out that maybe the root of the problem, maybe not right now, because maybe you're not trying to have children right at the moment, and you don't know that these are the things that are going to maybe down the road be an issue causing obviously you to be infertile. So for sure, check yourself out.
Still, you don't want to be in pain though either, Steph. So even if you decide you know you're never going to reproduce, that's fine. But you also don't want to be stuck connected to a water bottle and living in your bedroom for a week every month.
Yes, pain is not what you're supposed to live in, and this is not where we're supposed to like normalize either. Periods aren't supposed to be painful 100 all the time. Not telling you can't have a bad day and you feel moody and you're obviously having a little cramp here and there. Just so you know, I get really bad cramps from drinking really cold drinks or spicy food. Like these are things that I've noticed are really big common denominators for every period of mine. And if I cut them out, I don't actually get the cramps as bad. I don't. Exactly. I'm fine. So if you have maybe a thing that you're noticing that you may be eating or having, that's a common denominator every single period, cut it out and see if it obviously eliminates the symptom of like having extra cramps, or obviously for me, it's not a heavy blood flow. It's always just the cramping feeling. So if you're thinking of that and associating to what we're talking about, don't go extreme and think that you're having some issues. Just try to do the cross elimination process first. If you're still having heavy blood flow and you're having really bad symptoms and really, really bad cramps, nausea, headaches, migraines, all of that, then for sure, I can't, I'm getting distracted with Allie over here with the little blue.
Sorry, I just thought I'd introduce you to Sonic the Hedgehog, Stephanie.
Oh my, come on, I'm a sucker for dogs. Come on.
Look at his feet.
I can't.
He's legitimately Sonic.
Like, he looks like Sonic. Oh my God.
Look at his little Burberry tie. Look at his little Burberry tie. He's wearing a Burberry tie. So stylish.
What a stud. Wow.
He's a total stud.
You guys, anyone actually ladies.
If you're listening to this and you haven't watched it, you need to watch the YouTube so that we can actually show you.
Yeah, I'm sorry. I got distracted. She's showing this dog to me. But you guys, literally, I'm so excited about these next few weeks because Allie's going to have a positive exchange. I know it. I feel it. I have really good energy going.
I really want that. And look, as per usual, I'm going to walk into this and protect my heart somewhat and be hopeful and be positive, but not define everything and pin everything emotionally into one process, because you just can't. If there's anything that I've learned in the IVF process, it's that you've really got to become I'm resilient as fuck. We know this, but even I have had to temper myself on occasion and remind myself that, hey, the stats are against you 9 times out of 10. So you've got to be positive, but you can't let, you just can't let a bad or a negative situation once or twice just derail your faith. Do you know what I mean? So, I'm keeping the faith. I'm saying super positive, but I'm
agree.
Also I think just realistic.
But you're still going to be very faithful, very hopeful, very positive. At the same time, we're sending all of our good vibes. So everyone, please make sure you say a little prayer, say a little wish for Allie, and you obviously send her the good vibes and good messages leading up to her transfer.
Thank you. Yes, and thank you again, everyone who's been following, that has been reaching out, has been supporting my journey, and has been wishing me well. I really appreciate it. I'd also, really welcome anyone to send me questions. If you're going through this, or you're about to embark upon it, or you want questions answered, and just even pick my brains on stuff, send them through. Contact me on social media. I've had a lot of people do it. I really love engaging with women going through this journey. And if I can help any of you, even just one of you, with something to do with this whole process, then I find so much satisfaction out of being able to pass on from my own experience.
It's valuable.
I gotta have something good come out of it, right? So if I can
Hey,
help
it's
others,
all
that's one
valuable.
good thing.
So I love following it. I love being a part of it. And I just cannot wait to have a little, little nephew.
I can't wait to have a
little
little nephew for you too. I'm like, get it, hurry up already. You know,
Yeah,
one
just
good
get
thing
here.
is, we could actually walk around in the street in Dallas somewhere and people could think it really is related to you because it's going to be a little caramel latte, little half.
You're saying he's going to come out tan?
I'm thinking it's going to have a little flavor there, darling. So it could
I'm sure.
You could believe it.
I will babysit anytime. You can just send him over or just come visit. So everyone, thank you so much for listening.
Thanks so much for tuning in.
We'll see you guys next time.
See you next week.
Bye-bye.
Thanks for tuning in to another episode of the Queen Divas, Queens of Fitness podcast. Make sure you follow us on Instagram at Queen Divas Pod, on Twitter at Queen Divas 4, and follow our hosts on Instagram, Alicia at Alicia Gowans _WBFF Pro, and Steph at Stephanie Ayala 7. See you all next week.